My name is Johnathan Perry. I'm an orthopedic surgeon practicing at Tri-City Orthopedics. I've been here since 2009. I specialize in orthopedic sports medicine. I treat people or see a great number of patients with rotator cuff tears, probably the number one. Well, the most common symptom actually of a rotator cuff tear is a patient coming in with shoulder pain. Not everybody has to have a repair. If they don't, then we're simply trying to have them or treat them in a way that will minimize their pain or eventually get over the pain and to strengthen the other muscles around their shoulder. Really, the number one reason to operate on a rotator cuff tear is the amount of pain the patient is experiencing. When I perform rotator cuff surgery, I do what's called arthroscopic repair. This requires 3 to 5 little tiny incisions around their shoulder. When I do that surgery, my hands never go inside the patient. We don't cut through the muscles of their shoulder to get inside. And we're able to repair the tissue or the rotator cuff tissue back to the bone from where it was torn. When you do it arthroscopically, the advantages of that are, number one, it's better cosmetically, so people like that. They don't have a big incision, a big scar. Also, there's quite a bit less pain. Unfortunately, you have to be in a sling for 6 to 8 weeks. Doesn't mean you're not removing the sling. We are taking the sling off after a couple of days. They get to move their elbow. Most patients start physical therapy while they're still in their sling, but they do go to physical therapy, remove the arm from the sling. That happens anywhere from 3 to 6 weeks after surgical intervention. And then basically while the tissue's still healing, we're having the patient regain their range of motion slowly. We teach them exactly how to do that because number one goal is to get that to heal. So we get their range of motion back, takes 8 to 10 weeks, and then we start a strengthening process, which is strengthening the tissues that we repaired, but also all the other muscles around the shoulder that bring back function.